Hello, G Voices family, and welcome back to another episode of the G Voices. I am your host, Jibril. Today, I am diving into a topic that touches every household in Gambia, from Banjul to Basse, a topic that also determines how developed our country is, a topic that determines how long we live, how healthy we are, and also what kind of country we want to build for ourselves and also for the next generation. So the big question is, why are Gambians die young? I've been very intentional about this, considering we are all living witnesses to these events, one way or the other. You wake up today and they said someone died. The same story. We have not heard that he is sick. Or suddenly, before we reach to the hospital, the person is just gone. And I've been thinking about it for a while before presenting this topic. So I hope that we all benefit from today's topic. Why are Gambians die young? Why is our life expectancy still lower compared to other countries or many other countries around the world? Today I want to break it down and we have a conversation. But most importantly, what can we do about it? First and foremost, what do we mean by life expectancy? It simply means that the number of years a newborn baby is expected to live, assuming that current conditions stay the same. And if children are dying young, life expectancy drops. If adults are also dying from preventable diseases, life expectancy drops. It tells us what kind of health system we have. In many countries, people live well in their 70s and 80s. That reason being the reason most of the countries are uh, increasing their age of retirement because they have a healthy population that live longer. So, but in the Gambia, yes, we still maintain our retirement age at 60. This doesn't come out of blue. There are reasons why we retire at 60. But can we ask ourselves, why can't it be increased to maybe 65 or maybe even 70, 67, 69? Why? Those are the reasons why these questions, why do we die young or younger than expected? We have seen in many situations where at the age of retirement, some of the people are still active and they are lobbying for contracts to be extended. But again, we have a very youthful population. But if our people are dying young, in their 40s, in their 50s, and early 60s, this is very concerning. While other countries are seeing their citizens well into their 80s, living well. So in Gambia, uh, the life expectancy at birth is 61.5, if I got these statistics right. And the females constituting 62.3, and the male folks 59.6 years. So this is just the life expectancy. When we look at the healthy life expectancy, these figures might even be lower. I understand from a policy standpoint, the Gambia wants to raise this life expectancy from 65 years to 75 years. But is it our health system or our lifestyle or even poverty? Of course, even the environment, are they the cause of these problems? Or is it genetics or is it faith? In most cases, I want to believe it's mostly health, environment, and also our lifestyle factors that we can understand and improve. So one of the main reasons why we die young uh, is infectious diseases, malaria, respiratory infections, TB, diarrheal diseases. These are also part of our daily life. A simple mosquito bite can lead to severe illnesses. Contaminated water can lead to deadly diarrhea, and these diseases hit children and older adults hardest. Another indicator is high maternal and child mortality. Maternal mortality remains high in Gambia due to several reasons, but mainly limited to access to emergency obstetric care, delayed care seeking, and even long distances to health facilities, particularly during in the rural Gambia. Infant and under 5 mortality also remains high due to malnutrition, infections, and inadequate neonatal care. And again, from our policy standpoint, from the Gambia, they want to reduce this. I want to make this topic of less statistics, but sometimes where it is important, I will, extremely important, I will quote some statistics for you. And again, this might be the official figures. And again, it's also important to highlight that data management is a serious issue in the in the in the Gambia generally, not basically in the healthcare sector. So from 289 per 100,000 deaths, they want to reduce it to 70 to 100,000 deaths from 100,000. And also they want to reduce infant mortality from 42 in 1,000 to 12 in 1,000 or even less. To also reduce the under 5 mortality rate from 56 per 1,000 to 25 per 1,000 or less. And since life expectancy is strongly linked or influenced by child survival, these high mortality rates reduce the average. The rise of lifestyle diseases, the new silent killer, relatively, I would call it. Once upon a time, our parents or grandparents did not have these problems as much as today. Hypertension, diabetes, uh, stroke, or heart attack are rising fast in Gambia. Why? Why? Because most of the reasons would be heavy salt diets or salt heavy diets. In Gambia, I think is in one of the among the few countries that will put salt in stew and also in rice. So it also really contributed. Too much sugar intake as well, and lack of exercise or inadequate exercise. I'm quite impressed now. Most of our youths are quite active. They go to the gym regularly, but it's not only about that. How about the elderly? How about the women? And how about our workplaces? Are they friendly for these things in the work environment? Which I think is important. Smoking and alcohol also is also a factor in this rise of lifestyle diseases I mentioned earlier. And many people die suddenly in their 30s, 40s, and 60s due to these preventable conditions. Another important factor is poverty and socioeconomic factors of our living conditions. Poverty affects everything: what you eat, where you live, whether you can afford medical care, or even transport to the hospitals. And some families have chosen to between going to the hospital and buying food. I understand that large population or proportion of the population lives below the poverty line, less than $1. Poverty impacts access to nutritious food, even clean water, health and education. Economic hardships contribute to long-term health vulnerabilities. It's a factor. Water and sanitation, hygiene problems are also another key indicator. Limited access to safe drinking water, especially in the rural Gambia, is a great concern. And even in the urban sector, the proliferation of individual boreholes are many, and those who can afford it. But again, how do we sanitize it? How do we ensure that the proper management of this water from infection can be done, or can we do? Poor sanitation services or facilities is still a concern. Inadequate waste disposal, a big challenge in the urban sector. This increases exposure to many infections and a limited health infrastructure. Although improving, the health system faces challenges: shortage of skilled health workers, limited specialized care. We have we are seriously limited in specialized care, let's say oncology, cardiology, the numbers are quite limited. Frequent drug stockouts, inadequate drug supply, it's also another concern. And frequent gaps between rural, or infrastructure gaps, I would say, between rural and urban areas is also another challenge. Yeah, and most serious cases are referred to Senegal, India, or Turkey, and many cannot afford these things. Yes, environmental climate change is making things worse, believe it or not. Every year we experience lots of floods in Gambia, which also affects our food insecurity. All of these things add pressure on our health. The health system financing and governance challenges. Even though Gambia is still working on the national insurance, which is quite commendable, and I hope they able to roll this the soonest possible time. I understand a lot of administrative work being done, but I think the sooner they start helping the people, the better. Dependence on donor-funded programs for vaccines, which is good. Malaria, HIV, limited domestic funding for health. It's also another challenge. Currently there is the tabling of the 2026 budget into the parliament, but again, most of the things that are into health are personal emoluments. So the development part of it is quite serious. Is underfunded, seriously underfunded. And the structural changes in scaling of high quality across the country is another quality, is another challenge. And the proliferations of private clinics, it's a concern, you know, where quality or monitoring is quite limited, and public health care is also lack of serious materials, drugs. Yeah, it's a concern, and these things need to be really be monitored, and quality, particularly the private sector. They don't want to register deaths. They focus more on profit, and the quality is limited. And every time they have a challenge, they are delay in the referrals. These are serious concerns. Yes, and I think this we should have a national conversation. You go to the private clinics or hospitals, their customer care is better, but it's not enough. What they are doing is the most important. Their services in terms of proper diagnosis, proper treatment. It's a concern. And we are aware all of these things are referred to the public when they can no longer manage it, when they already, milk us from the meager resources from the poor. So the government, we can do something about it, to be quite honest. I know the laws are there, the units responsible for quality monitoring, they are there, but they must be empowered. So we can do something about these things. Government and health system actions, they must invest in maternal health. There is a lot of money into maternal health, but the deaths are unacceptable, to be quite honest. Strengthening our primary healthcare is another thing that is also important. We used to be among the best countries in primary healthcare, but it has seriously weakened. We should get back to glory old days. We should retain and maintain specialists. Yeah, we should train and I cannot emphasize that enough. They are doing well in terms of medical officers or doctors. They have a career path that they follow, and they are bringing professors and so many doctors enrolled into these programs. So they are improving on that area. But in terms of nurses or nursing, that's a serious neglect to that area. So if we want to improve on train and retain specialists, we also look at the nursing community. They should also have a career path that they should follow, and with promotions. And I think that will seriously develop our healthcare. Even though the healthcare status in Gambia is unsustainable, our main priority should be on preventative health. I think we will be able to create more impact, but the pressure on the healthcare is quite unsustainable. We have serious limitations in terms of specialists, and in terms of even the numbers. So definitely we should do more in terms of public health prevention part of it. That is more sustainable, and getting back to the good old days on primary health care, that would really help the tertiary level which is our hospitals and teaching hospital. We should improve our water and sanitation. The National Water and Electricity Company, yes, a lot of money, also government interventions have been put into that company, but the results are not desirable. Yeah, I understand they want to divorce the water from the electricity, which is commendable in terms of efficiency and productivity. But these reforms are very, very, very slow, very, very slow. So as I said, the life expectancy depends on so many factors, and it's an indicator for development. Yes, you bring in all these the other development infrastructure, others, but if our people are not living long or longer, especially healthily, particularly healthily, it's a serious indicator for development. And I want to remind the government for that. Economic development, uh, institutional development cannot go without human development. So I think that is quite important to remind the government. There are community actions that we can do. Yes, malaria is doing very well in terms of using mosquito nets. I must commend the malaria programs for a great job in providing free mosquito nets to all antenatal mothers and even adults that are using will benefit from mosquito nets. This is quite important. People should have them self-tested for sugars and salt intake, for blood pressures and sugar checks. I think it's quite important. Let us reduce salt and sugar intake as well. And I also believe that the general uh, cleansing services that we used to do back then should come back. And I think the central government can take the lead. What we call set setup is quite important. Those actions are quite important for our health. And the health sector should be in the forefront in promoting that. Let's bring it back, even if it's 1 hour for every month is quite important. And not even set it up. People should promote having health activities, walk. We should have I know that in the social media I've been seeing the people of Khartoum Walk for Health, they've been doing that. And other institutions to promote health as part of their social corporate responsibilities. But I think we can do better and we can do more. If every institution dedicate a day in a month, an hour from their work schedule, and let them work, even to stop cars for an hour for people to go for exercise and walk along the roads or in their workplaces to go out. It can take this country, the Gambia that we all love, and can improve our health in no small way. So I think we can do that. Our health is, or your health is your responsibility. I would also say we must take individual actions. We must exercise. We must avoid smoking. We must seek care early. All these things are important. I know we cannot change everything overnight, but we can start somewhere. By knowing these facts, changing our habits, holding each other accountable. Look, imagine a Gambia where people live longer, healthier lives. It's possible, but it starts with awareness, education, and action. That's why I'm doing this today. Yes, we can change the story. We can live longer lives, healthier, happier, and stronger. But it will take awareness, behavioral change, and commitment from all of us. With this, I thank you for listening for this episode, G Voices. If you enjoyed this podcast or conversation, I would call it, please share with your friends and family. Health information saves lives. And I've been your host, Jibril. Stay healthy, stay informed, and keep your voice strong with G Voices. See you next time. And bye from me.